has a child, be sure to come to the store. Any size of Smarty Baby diaper that you purchase, you get the opportunity to enter a draw for a chance to win a brand new stroller with a detachable car seat. And that draw goes on all the way to March 20th. Well, March 2nd, sorry. I apologize. All the way to March 2nd. And so if you know someone who would benefit greatly from that car seat and of course safety first for the babies, you come in and you buy any size of the Smarty Baby diapers and automatically you're entered into that draw. So definitely don't miss out on that. For the carnival season, we have the Masquerade Your Senses with LNKT. For those of us who do not know what LNKT is, that is Jolly's signature perfumes, scents. And we have one for men and one for women. So you can come on down to the store and ask about the LNKT linked perfume for men. That's Alpha. Really nice smell on there. And of course, the perfume for women, Siren. So for this season, if you'd like to definitely call persons to yourself, these are some of the scents that you can try, the fragrances that you can masquerade with on the road. So this Valentine's, of course, that's coming up as well. Ignite your senses with these perfumes and enjoy the vibrant energy of Dominica Carnival. So the draw is on February 9th and the deadline is February 6th. So, of course, come to the store, purchase, and get the opportunity to win a costume. Now, again, like I said, we have a lot in store. So, a third thing I want to talk about is the Love and Play bundle. Valentine's Day, February 14th, for those of us who don't know. For those of us who may have a Valentine's, may be your own Valentine, may not necessarily believe or think about Valentine, but it's an opportunity to get everything you need for a night of passion and connection. So log on to jollies.dm to shop. We do have your intimates there, your sensual toys. We have our massage oils. Definitely check into the store to try to sample some of those, the massage oils, and everything to make that night special for you and your partner. So be sure to come into the store, ask us about the promotions that we have going on, and we have a lot to offer you for this season. So we're just going to take a break, and when we come back, we will let you know more about what we have in store.
Jolly's Pharmacy is bringing vibes to health with Health Vibes. Health Vibes. Each and every Wednesday from 10 to 11:30 a.m. with your hosts, Trudy Kristen, and co-hosts, pharmacists Jacinta Fagan and Leona Jeremiah. Education, information, and a bit of humor. And not forgetting lots of vibes. Jolly's Pharmacy is bringing health and vibes together with Health Vibes. So be sure to tune in each and every Wednesday on Q95 from 10 to 11:30 a.m. Jolly's Pharmacy, leading the way in healthcare.
Oh, and if they say convenience can make a big difference, then you can trust me. I know just where you should be. That is JP Mega, 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 Mega. The one-stop shopping, Dominica, nigga, 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 nigga. You could be shopping and having fun. Shop if you're not if you're so shop. It's a to everyone. What a happy place, happy place. Oh, JP Mega, 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 Mega. The one-stop shopping, Dominica, nigga, 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 nigga. You could be shopping and having fun. Shop it's a to everyone. What a happy place, happy place. Oh, what a happy place. But just pick some more any item and you automatically qualify for discounts. Check us out at the Mega Store in Fongbode where there's lots of parking on Monday to Friday from 9 a.m. to 7 p.m. On Saturdays from 8 a.m. to 6 p.m. and on Sundays from 10 a.m. to 2 p.m. JP Mega, the best family shopping experience.
We come this morning feeling risky. I had been vicious and calling sick, but I end up in Jolly's Pharmacy. And don't in the street, Jolly's fix up my immune system. Me feeling fit and strong now. I'm not the work I pick on any mission. If you see me again, Jolly's Pharmacy is number one. Jolly's for you. We cater for everyone. Jolly's for you. It's the immune system. Jolly's for you. Yo, Dominic, it's about Father Box. Whenever I'm in town and I'm feeling down, I head to Jolly's Pharmacy. They boost me up real quick. Jolly's Pharmacy, leading the way in healthcare.
Jolly's Pharmacy is bringing vibes to health with Health Vibes. Health Vibes. Each and every Wednesday from 10 to 11:30 a.m. with your hosts Trudy Kristen and co-hosts pharmacists Jacinta Fagan and Leona Jeremiah. Education, information, and a bit of humor, and not forgetting lots of vibes. Jolly's Pharmacy is bringing health and vibes together with Health Vibes. So be sure to tune in each and every Wednesday on Q95 from 10 to 11:30 a.m. Jolly's Pharmacy, leading the way in healthcare.
Oh, and if they say convenience can make a big difference, then you can trust me. I know just where you should be. That is JP Mega, 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 Mega. The one-stop shopping, no me, nigga. You could be shopping and having fun. Shop if you're not if you're so shop. It's a to everyone. What a happy place, happy place. Oh, JP Mega, 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 Mega. The one-stop shopping, no me, nigga. You could be shopping and having fun. Shop if I it's a to everyone. What a happy place, happy place. Oh, what a happy place. But just fix some more any item and you automatically qualify for discounts. Check us out at the Mega Store in Fongbode where there's lots of parking on Monday to Friday from 9 a.m. to 7 p.m. On Saturdays from 8 a.m. to 6 p.m. and on Sundays from 10 a.m. to 2 p.m. JP Mega, the best family shopping experience.
And we're back with Health Vibes this morning. I'd like to say a special good morning to our regular listeners. And of course, we are live on the Facebook page. And I see we have quite a few of our usual signing in. So I'd like to say good morning to Mr. Anthony, to Hazel Ann, Miss Anthony, sorry, Wednesday morning. Good morning, Health Vibes family. Good morning to you, Hazel Ann. And of course, you are an extension of that family, always here. And special good morning to Julia as well. Blessings to you on this Wednesday. It's definitely starting out to be a great day. The weather is clear. The sun is out. As you know, it has not been that consistent for the time being. But at least today you can get a little bit of vitamin D. Try to walk outside before you get to work. Or even if you have a snack break on your lunch break, try to take a little 15 minutes, 10 minutes in the sun, get our mood up, our energy up, all of these things that make the day better. Right? So today I want to talk a little bit about some global pharmacy news before we get into our topic of the day and what that means for us here in Dominica. So one of the things I want to mention is that there has been the World Congress or the World Congress of Pharmacy and Pharmaceutical Sciences and of course regional Caribbean Association of Pharmacy conferences. Now, a lot of times we don't know what happens in the background. As the general public, we know that our pharmacists are well equipped to serve us and that whatever they are doing, is keeping them on top of things. Now, these conferences are part of the education that keeps your pharmacist at Jolly's Pharmacy so on point, that keeps us learning, that keeps us, ahead of things in terms of what is out there, treatments, and of course the healthcare plans tailored to you. And so with these conferences, it gives us the updated knowledge on drug safety, side effects, and of course new treatment guidelines. So in recent times, for the end of 2025 into 2026, we've seen a lot of changes in the healthcare setting as to common treatments for diabetes, hypertension, all of these things. So naturally, when we meet in these conferences, we're able to share that knowledge. We're able to discuss those different treatments. And for those of us that might be wondering, what our new medication is for, what benefits it over the old one. Some people come into the pharmacy and they'll say, I had Bezide, but they just changed it to this long thing, hydrochlorothiazide. And you're wondering what exactly that does for you. So all of these we get from these conferences, information that we gather, and it helps us with safer dispensing practices. It helps us tailor medications towards you, the community. We're predominantly a Black nation. All of these things factor into your medication and your dispensing. And of course, it expands our pharmacy roles. And so, besides just dispensing, which is seems to be the main thing sometimes, right now we're doing a lot of vaccination sales. So all of these discussions you can come in and have with your pharmacist. Ask about vaccinations, ask about your chronic diseases. Let us help you with your health process. And of course, our health screenings are always available at every branch. You can come in and get basic checks like your diabetes, your blood sugar checks. You can get your blood pressure checks as well and let you know where you are. Access to new treatments and innovations. Of course, these discussions often include new medicines, biotechnology advances, and digital pharmacy tools. Some of those you will see later down this year. So, early awareness of these new therapies for asthma, diabetes, hypertension, and of course, digital refill systems. That's one I really wanted to mention. You have the option of calling into the pharmacy and getting your refills prepared at whichever branch you prefer so that you beat the line. All of these things that we offer at Jolly's Pharmacy. This morning, I just want to say a special good morning to all the pharmacists and the pharmacy technicians listening. Your hard work is often seen by, your colleagues as well as our wider pharmacy family. Good morning to Coralie. Thank you for listening in. And a special good morning to my co-host, Trudy Christian, who is here with us now. And Trudy, how has the day been so far?
Hi, morning, Leona, and it's been a busy day thus far, but I'm here. Good morning to the listeners of Health Vibes. Good morning, of course, to all of you regulars who are on the social media platform of Q95 FM. Leona, good morning to you, and we are supposed to be having a guest in studio. The guest is maybe having a similar issue that I had as it relates to getting a parking, and so we'll see how that goes. But I have been listening to you holding down the fort in studio, and we do have quite a bit scheduled for this morning, so hopefully we can get started with our topic in just a bit.
Yes, definitely, hopefully. And I know that the traffic is not without reason. I'm hoping that we are very productive today at all our individual jobs. I know there's a lot of traffic in the town in terms of foot traffic. So there's a lot of persons in the town, a lot of tourists as well. So I'm hoping that one way or the other, we get to interact with a lot of persons today and our productivity levels are pretty high.
Yes, Leona, there's quite a bit going on at Jolly's. I don't know if you have gone through all of them.
I've gone through quite a bit. I went through quite a bit.
All right. So I guess what we'll do right now, we'll take a break and let's check on the status of our guest. And we will be right back with you. Of course, if you tuned into Health Vibes, you need to stay tuned because we are expecting a very interesting show, very interesting guest, a very interesting topic. So stay tuned. We're taking a quick break and we'll be right back.
Introducing Jolly's Pharmacy, brand new website, www.jollies.gm. It's your time to jump the line. Shop now at jollies.gm and have your items delivered in the comfort of your office. No more standing in line. No need to use your lunch hour to shop. Hassle-free shopping, safe and secure. Jollies.gm features rush delivery, 1 hour. In-store pickup, regular delivery, 5 p.m. Cut-off time, 4 p.m. It's your time to jump the line. Visit us at www.jollies.gm. Jollies Pharmacy, leading the way in healthcare.
Oh, and if they say convenience make a big difference, then you can trust me. I know just where you should be. That is JP Mega. Stop shopping down nigga. You could be shopping and having fun. If you got a happy place, it's to everyone. What a happy place. Oh, JP Mega. The one stop shopping down nigga. You could be shopping and having fun. It's to everyone. What a happy place. Oh, what a happy place. But just fix some more any item and you automatically qualify for discounts. Check us out at the Mega Store in Fongolia where there's lots of parking on Monday to Friday from 9 a.m. to 7 p.m. On Saturdays from 8 a.m. to 6 p.m. and on Sundays from 10 a.m. to 2 p.m. JP Mega, the best best family shopping experience.
Woke up this morning feeling rich thing. I had the intentions to call in sick, but I end up in Jolly's pharmacy. And don't in the street, Jolly's fix up my immune system. Me feeling fit and strong now. I'm ready to work and pick on any mission. If you see me again, Jolly's pharmacy is number one. Jolly's forget. We cater for everyone. Jolly's forget. The immune system. Jolly's forget. Yo, Dominic, it's about Father Box. Whenever I'm in town and I'm feeling down, I head to Jolly's Pharmacy, then boost me up real quick. Jolly's Pharmacy, leading the way in healthcare.
Jolly's Pharmacy is bringing vibes to health with Health Vibes. Health Vibes. Each and every Wednesday from 10 to 11:30 a.m. with your hosts, Trudy Kristen, and co-hosts pharmacists Jacinta Fagan and Leona Jeremiah. Education, information, and a bit of humor, and not forgetting lots of vibes. Jolly's Pharmacy is bringing health and vibes together with Health Vibes. So be sure to tune in each and every Wednesday on Q95 from 10 to 11:30 a.m. Jolly's Pharmacy, leading the way in healthcare. Jolly's Pharmacy is bringing vibes to health with Health Vibes. Health Vibes. Each and every Wednesday from 10 to 11:30 a.m. with your hosts, Trudy Kristen, and co-hosts pharmacists Jacinta Fagan and Leona Jeremiah. Education, information, and a bit of humor, and not forgetting lots of vibes. Jolly's Pharmacy is bringing health and vibes together with Health Vibes. So be sure to tune in each and every Wednesday on Q95 from 10 to 11:30 a.m. Jolly's Pharmacy, leading the way in healthcare.
Oh, and if they say convenience can make a big difference, then you can trust me. I know just where you should be. That is JP Mega. The one-stop shopping for me, nigga. You could be shopping and having fun. Shop with your daughter, with your son. Shop later to everyone. What a happy place. Oh, JP Mega. The one-stop shopping for me, nigga. You could be shopping and having fun. Shop later to everyone. What a happy place. Oh, what a happy place. But just take some more of any item and you automatically qualify for discounts. Check us out at the Mega Store in Fongole, where there's lots of parking from Monday to Friday from 9 a.m. to 7 p.m. On Saturdays from 8 a.m. to 6 p.m. and on Sundays from 10 a.m. to 2 p.m. JP Mega, the best family shopping experience.
Woke up this morning feeling rich thing. I had the intentions to call in sick, but I end up in Jolly's Pharmacy. And don't in the street, Jolly's fix up my immune system. Me feeling fit and strong now. I'm ready to work and pick on any mission. If you see me again, Jolly's Pharmacy is number one. Jolly's forget. We cater for everyone. Jolly's forget. The immune system. Jolly's forget. Yo, Dominic, it's about Father Box. Whenever I'm in town and I'm feeling down, I head to Jolly's Pharmacy, then boost me up real quick. Jolly's Pharmacy, leading the way in healthcare.
Jolly's Pharmacy is bringing vibes to health with Health Vibes. Health Vibes. Each and every Wednesday from 10 to 11:30 a.m. with your hosts, Trudy Kristen, and co-hosts pharmacists Jacinta Fagan and Leona Jeremiah. Education, information, and a bit of humor, and not forgetting lots of vibes. Jolly's Pharmacy is bringing health and vibes together with Health Vibes. So be sure to tune in each and every Wednesday on Q95 from 10 to 11:30 a.m. Jolly's Pharmacy, leading the way in healthcare.
Introducing Jolly's Pharmacy, brand new website, www.jollies.gm. It's your time to jump the line. Shop now at jollies.gm and have your items delivered in the comfort of your office. No more standing in line. No need to use your lunch hour to shop. Hassle-free shopping, safe and secure. Jollies.gm features rush delivery, 1 hour. In-store pickup, regular delivery, 5 p.m. Cut-off time, 4 p.m. It's your time to jump the line. www.jollies.gm. Jollies Pharmacy, leading the way in healthcare.
Oh, and if they say convenience can make a big difference, then you can trust me. I know just where you should be. That is JP Mega. The one-stop shopping for me, nigga. You could be shopping and having wash. If you not a happy place, sunshine. It's to everyone. What a happy place, happy place. Oh, Jeffy, mega, 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 mega. The one stop shopping, no me, nigga, 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 nigga. You could be shopping around in Russia. I have my alone. It's to everyone. What a happy place, happy place. Oh, what a happy place. But just stick some more any item and you automatically qualify for a discount. Check us out at the Mega Store in Fonbole where there's lots of parking on Monday to Friday from 9 a.m. to 7 p.m. On Saturdays from 8 a.m. to 6 p.m. and on Sundays from 10 a.m. to 2 p.m. JP Mega, the best family shopping experience.
Wake up this morning feeling rich, think I had the impressions of calling sick, but I end up in Jolly's pharmacy. And down in the street, and it's fix up my immune system. Me feeling fit and strong now, I'm ready to work like it on any mission. If you see me again, Jolly's pharmacy is number one, Jolly's fucking. We can't talk for everyone, Jolly's fucking. Fix up your immune system, Jolly's fucking. Yo, Dominic is the part of box. Whenever I'm in town and I'm feeling down, I head to Jolly's Pharmacy, they boost me up real quick. Jolly's Pharmacy, leading the way in healthcare.
Jolly's Pharmacy is bringing vibes to health with Health Vibes. Health Vibes. Each and every Wednesday from 10 to 11:30 a.m. with your host, Trudy Kristen, and co-host pharmacist Jacinta Fagan and Leona Jeremiah. Education, information, and a bit of humor. And not forgetting lots of vibes. Jolly's Pharmacy is bringing health and vibes together with Health Vibes. So be sure to tune in each and every Wednesday on Q95 from 10 to 11:30 a.m. Jolly's Pharmacy, leading the way in health.
And we are back with you, of course. This is Health Vibes, and we promised today that we did have a guest who would be joining us. The guest has not been able to join us in studio, but will be joining us virtually. So we just had to sort that out. But if you are a regular listener to Health Vibes, and if you listened to the program last week, you would have heard us discuss thyroid disorders. Last week, we had on the endocrinologist, Dr. Natasha Maxime Fritz, and we did quite a bit as it related to the thyroid gland, where it was located, what are some of the things that can go wrong. And we spoke about that from a hormonal perspective. The endocrinologist, of course, spoke about the thyroid as it relates to hormonal imbalances that can occur. But today, we're going to continue with this very interesting topic, an interesting gland, the thyroid gland, but this time from the perspective of the ENT, the ear, nose, and throat specialist. And if you were listening to the program last week, you should be able to tell me where the thyroid gland is located and why the ENT is the specialist that we need as well to discuss the thyroid gland. So joining us virtually is Dr. Irvin Pascal, of course, known across Dominica as IP. Dr. Pascal, good morning to you.
Hi, greetings, Trudy, and greetings to your listening audience. I'd first like to apologize for not being able to make it to the studio now physically, but at least we can use the technology. Are you hearing me clearly?
Yes, you are coming through loud and clear.
Right, and so actually it was interesting that because I was on my way from Daybosh, where I don't know if you know, I'm still standing with those people who like Nasio Fountain and the others who are standing for Ma Dominique vis-a-vis what's happening with the mining at Daybosh. So that delayed me. But it was interesting because I was listening to the program on my way, and it really had me. I just say this before I start about the thyroid. It really had some of the things that I forgot her name. She was saying about drinking your water, and something else she said. Drinking your water and something else that I thought was so important. Oh yes, and getting some sunlight and vitamin D, which I was thinking these are the things that in a nature islander, somebody who lives in a place where we say we are the nature island of the world, that should be very important in our daily lives. How we prevent illness, how we prevent rather than look to cure for our medical conditions, and being adequately hydrated. I just want to reinforce what she was saying earlier about the importance of rehydration, not only before you go in the carnival band, but also on a daily basis to make sure you get enough fluids. And that rehydration, I think I wanted to make the point that in the carnival season, people might see drinking beer and alcohol and all of that as liquids and rehydration. And no, that is not enough. You have to now make sure you have adequate amounts of water and fluids that are not alcoholic based fluids that can dehydrate as opposed to rehydrate. And I think it's something important that as a nature islander myself and somebody who holds this nature island philosophy as sacred, that we should also do a nature islander is somebody who is about prevention rather than cure, using what we have locally to prevent illnesses before we have to go to the doctors to treat it. And two important things I like to reinforce that she said earlier was the issue of being well hydrated and the issue of getting some vitamin D. You're in the Caribbean. Right now, we have lots of patients. I even heard Doc talking about it last week in relation to thyroid issues, that often because the thyroid gland has some glands on it called the parathyroids that are involved in calcium and that's related to vitamin D. We're finding now lots and lots of people having to take vitamin D supplements because they're in an office all day. They like me this morning driving from home to work and just going straight to the office and leaving all this great free vitamin D that's available to them. And they can do that by, spending some time every week, go out in the sun, have a little walk at 9-10 in the morning and get some vitamin D. So I just wanted to, those are my reflections as I was rushing to get to the program. Right. So I thought I'd share them.
Thanks,
Doc. Yeah, that was Leona who was giving those tips. So Leona is the name that you were looking for. But yes, she. Yes, Doc.
Yeah. So, right. So we're talking about the thyroid gland, the surgical aspect of the thyroid gland this morning.
Yes. Right. Because we were told last week that for surgical intervention, the ENT is who you go to. So we wanted, a bit more on that aspect of things today on this show.
Yes. Now, what I would say before surgery, like everything else, it still goes back to prevention. And we usually end up having to do surgery for the thyroid gland, or what we call a goiter, which I re-emphasize that all a goiter is an enlargement of your thyroid gland. Mm-hmm. So everybody has a thyroid gland in their neck. It's shaped sort of like a butterfly, and it's in the anterior part of your neck, just below what we call the Adam's apple. So that's where it's found. Mm-hmm. And when it enlarges, it's pretty visible. And when it enlarges and you can see it, it's called a goiter. Mm-hmm. And as Doc was saying last week, that enlargement of the goiter can be a total enlargement of the gland. That means the whole gland is enlarged. And then when that happens, that can affect the function of the gland. Mm. And because the gland produces hormones for your body to function normally. So when it gets enlarged, it can either produce too much hormones or too little hormones or thyroid hormones, or it can produce just enough for you to function normally. Mm-hmm. So usually a global enlargement of the gland, if you can look at it as the whole thing is being enlarged, usually is associated with or can be associated with changes in the hormone production of the gland. And when that happens, you usually then have to get medication to deal with the enlargement. And the medication then allows the gland to function normally and reduce its size back to its normal size.
Okay.
Okay.
In
what,
case,
doctor?
yeah, go ahead.
So what warrants then moving from medication treatment into what would make it the point where you'd have to do surgery to remove some or if not all of the thyroid
Right.
gland?
Okay. Now, sometimes the gland is enlarged and it's producing a normal amount of hormones for the body to function. And then the question is now, why is it enlarged? Now, it may be enlarged for several reasons. So it may be enlarged because it has a growth in it called a nodule. And that nodule in it may be cancerous or can become cancerous. So also, if it's enlarged globally and it's producing too much hormones or too little hormones, and sometimes it can be difficult to control the overproduction of hormones with medication. Then there are two other options that you can use to control the overproduction of hormone and the enlargement of the gland. And that you can use something called radioactive iodine to shrink the gland, or you can then remove part of it surgically, and that helps to control the overproduction of hormones. So that's where the thyroid surgeon or the ENT surgeon gets involved.
Okay.
But primarily, the ENT surgeon gets involved when the gland is functioning normally and you still have this swelling. Now, this swelling can cause problems for the patient in that it can get larger, and the larger it gets, it can then affect your breathing, which is because the gland sits on your windpipe. So if it gets larger, it can then squeeze your windpipe or compress your windpipe and then make it difficult for you to breathe. It can also make it difficult for you to swallow. Also, as the gland gets larger, cosmetically, especially for ladies, this large growth in their neck is considered unsightly, and then becomes a cosmetic concern. But more importantly is that this enlargement of the nodule, or this enlargement that is not producing excessive hormones, can be a precursor or can be a stage before that swelling becomes cancerous. So then there are criteria that determine, as a surgeon, whether you remove the gland or not. So whether you don't remove the gland, whether you remove the growth or not.
Okay.
And so the growth now can be removed by itself, or it can be removed by removing the total gland.
Okay.
If you understand what I mean, you're following me.
Yes.
Right. So a decision has to be made whether you remove the growth or whether you remove the whole gland. And so that's why it's important, as Doc was saying last week, that you do what we call a biopsy of the gland. So it's just like taking blood. You take a biopsy with a needle, you put it into the gland or into the swelling, you take a sample of it, you send it to the lab to check it to see how bad it is, if you want, or whether it looks like it can become cancerous, and then you make a decision as to whether it is removed or you remove the whole gland. Now, if when you do the biopsy, it doesn't show anything significant or alarming, you have two options, or the patient has two options. They can either, as a preventative procedure, have the swelling removed, or it can be observed and monitored, because sometimes that enlargement of the gland that we call a goiter, it can stay at the same size for the rest of your life, but it can also increase, and it can also become malignant. So it's a decision that is made now with the patient as to what they would like to do. either you can monitor it every 4 to 6 months by repeating the blood test, repeating the biopsy, and repeating the ultrasound to make sure nothing is changing. Or they can decide, you know what, I am 25, I have this lump in my neck, it may become cancerous, it may get bigger, and I don't like to see it anyway. It may get bigger and have cause other difficulties for me. So I will elect at this stage to just remove it or remove part of it.
Doc, this is where I have a question. Well, you answered the first one I had as it related to the time, the amount of time that you would have to be monitoring it for. So you said 4 to 6 months, you would be repeating tests and so on. But my question is as it relates to risk of surgery. If you opt in to remove a portion or the entire gland, and it is an elective surgery, it's because, as you just mentioned, you maybe are young, you don't like the appearance of the lump, it is not cancerous, but you just want it gone. What are the risks associated with an elective surgery to remove the thyroid or part of the thyroid?
Yeah, that's an excellent question because, okay, like all surgery is associated with some degree of risk. So living every day, driving to work, getting wherever you have to do during the day is associated with some level of risk to your well-being. So having surgery in your thyroid gland is no exception, but the risks depend on the degree of surgery. The risk depends on the individual lifestyle. The risk depends also on whether you remove all of the gland or you remove part of the gland. But the major risk, and as I tell all patients, especially those who are concerned about cosmesis and appearances, is that you can have a scar in your neck where your neck was incised to remove the gland, because you can get what we call in local parlance a growing flesh there. Like anytime you get a cut anywhere, you're at a risk of having growing flesh. So that's maybe the most minimal risk. Besides the risk of the anesthesia being put to sleep, all those are considered best or general risk of surgery. You can have risk of, one of the other risks if you remove the whole gland is that you now have to take medication to replace the hormones that was produced by the gland for the rest of your life. Okay? That's risk number 2. The other risk is that if you only remove part of the gland, which has happened continues to happen, because you might decide, or I might decide with the patient to remove just the part of the gland that has the growth and leave the rest. What is left is also at risk for becoming enlarged in 10 to 15 years.
Okay.
So that's considered a risk of the surgery, that you might have to have a second surgery 10, 15 years later because you did not remove the whole gland when you were 25. But the advantage of not removing the whole gland when you're 25 is that you don't have to take any medication for the rest of your life, or maybe for the next 10 to 15 years. Okay. So these risks have to be weighed with the patient. But the major risk related to thyroid surgery is the risk to your voice box. Not even your voice box, the nerve that is responsible for you having a normal voice. That nerve in every thyroid surgery, there are 2 nerves that supply your vocal cords, your right vocal cord and your left vocal cord. And every thyroid surgery, those nerves are at risk because those nerves are attached so close to the gland that there's always a risk, not even that you will damage the nerve, but just operating in the area, you can traumatize the nerve, you can maybe just touch it, and that could affect its function for, let's say, 4 to 6 weeks after the operation, where your voice is not normal. Now, this is important particularly for people who use their voices professionally. For example,
Yeah, your
people who sing in
performers,
choirs,
singers. Yeah.
yeah, teachers, politicians, lawyers, and people who want to always have a normal voice.
Mm-hmm.
So that's a major risk for them, especially when you're removing the total gland. But it's a risk. I mean, although it's a risk, it's in present the thyroid surgery, with the help of technology, and so those risks are much less. That risk of damage to your vocal cords is much less than it used to be before. One, because of the advances in the approaches to doing that type of surgery.
Mm-hmm.
So that's why it's important that people who are accustomed and proficient in the surgery are the ones who perform that type of surgery, and the ability to monitor the nerve during the operation, so that whenever you might be damaging it or whenever you might get close to it, you can be forewarned, and again, to prevent damage to it. The other risk that is important as well is the risk of having to take calcium supplements for the rest of your life, because as Doc said last week, there are 4 small glands that are attached to the back of the thyroid gland, and are sometimes even incorporated into the thyroid gland. And those glands produce a hormone called the parathyroid glands. So they are parathyroid, they are attached to the thyroid, and they produce hormones that function to control your calcium metabolism. So if you remove the gland and those small glands are damaged as well, you are at a risk of having to take calcium supplements and vitamin D supplements, going back to for the normal function of your body.
Okay. So risk to the vocal.
Okay?
Yes, you
Yes, doctor.
there was a little gap in what we were hearing, but we heard you come back on. Doc, risk to the vocal cords, risk in terms of the parathyroid glands. I know we did have a listener last week on the program who mentioned that her voice changed permanently. I know you just mentioned the voice might be changed for some time, but is it something that you've seen as well, of a permanent change in voice, or permanent let's say reduction in vocal ability?
Yes. In the majority of cases, your voice does return to normal, because in the majority of cases, the nerve isn't damaged directly.
Okay.
Sometimes it can be the supply to the nerve. Sometimes it can be a little bleeding after the surgery that affects it. So that is temporary. But if the surgery, sometimes when you have a difficult procedure, when you have a very large gland, if it's a cancerous gland, the nerve is at higher risk of being damaged. And if the nerve is damaged, and by say damage, I mean cut during the procedure, then the voice changes to permanent.
Doc, what about yes, we heard you.
Okay.
What about you mentioned as well that the thyroid gland is proximal to the windpipe, the trachea. Any risks of damage there?
Well, not incompetent, not with hardly likely with a competent surgeon.
Okay.
But again, if the gland has been allowed to get so large, and it's been there for so long, and then you have to remove it because it's been there so long, just removing it from its attachment to the windpipe, you can get damage to the windpipe, but usually it's because the gland being there for so long has already damaged the windpipe. So as soon as you remove the gland, then you see the damage, because it's like the pressure from the gland over several years, it erodes the structure, the wall of the windpipe. So what happened? The thyroid gland is there but if you now have to remove it, because especially if it's cancerous and you have to remove the whole thing, you can potentially get damage to the windpipe. But that is unusual because especially if you are proactive and you're preventative and the gland is removed early and stuff, that hardly ever happens. But it is a potential complication that can happen. But that usually happens if you have a very, very large, difficult thyroid that is maybe cancerous, that has already eroded the windpipe.
Another question for you, doctor. I know a lot of persons who first notice that bulging or that goiter are often nervous in terms of checking it in the first place. Can you tell us a little bit about the biopsy itself and how invasive is that in terms of, how long might it take? Do you experience pain afterwards? Does healing take time? Because these are the things that we often hear from persons.
Okay. Right. No, like everything else, once you start to see a growth anywhere in your body that wasn't there, it's normal to be concerned and anxious about it, and it should be investigated. So I would say that it's better in 2026 to go and have it checked rather than let the fear of what it may be prevent you from going to see your physician or your surgeon about any swelling that wasn't there in any part of your body that you're now seeing. That's the first thing I would say. The investigation of a lump in your neck that may be your thyroid is basic and straightforward. And it involves, number one, checking to make sure that the swelling is producing normal amounts of hormones. So you'd have some thyroid hormone tests. Then it involves an ultrasound to see how large the swelling, to confirm that the swelling is coming from the thyroid gland and not from something else, and to give you an idea as to how serious it is in terms, because on the ultrasound, there are little pointers that might tell you this could grow, this is serious, this might become cancerous, or even that it may be cancerous. There's things that the radiologists can see on the ultrasound. So that's why the ultrasound is very important. The ultrasound is also very important because you can also biopsy this swelling, the suspicious swelling that it would be when you're doing the ultrasound. So it gives you, especially if it's a small swelling, although you can biopsy it without the ultrasound the biopsy is better performed using an ultrasound at the same time. So we call that an ultrasound guided biopsy. And all it involves is that whilst you have in the ultrasound, the radiologist or the surgeon introduces a needle into the swelling and removes a little sample, no different from when you're having a blood sample being taken for testing. So it's the biopsy is a pretty, I know when people hear biopsy, they
get scared.
They figure they have to cut your neck open and get a big piece. No, the biopsy is called a fine needle biopsy. It's with a very fine needle, and it's no different from taking blood, from going to the lab and having blood taken. It's just that it's called the biopsy. I suppose the association of the word biopsy is usually associated with cancer and biopsy serious. But no, in this case, the biopsy is really to assist in having a lot more information so that the surgeon can make the correct decision for the patient.
Right.
Doc, today's World Cancer Day. On the topic of cancer. Yes.
Oh, it is?
Yes, it is. On the topic of cancer, how frequently, of course, in your experience, how frequent is, or how prevalent is thyroid cancer? So those biopsies that we're discussing, is that a common enough form of cancer?
That's a great question. I'll just say on the outset, thyroid cancers are not very common.
Okay.
Not very common. They are. offhand, I mean, I can't remember exactly the percentage of all thyroids, all goiters, or what percentage of them are thyroid, but it's very rare. I've been doing thyroid surgery for, what, I don't know, 30, 40 years now. And I can count, especially in Dominica, the number of patients on one hand that I have found maybe less than 10 people about thyroid cancer. Is that there are several types of thyroid cancers, but except for one type, basically, you can get complete cure of your thyroid cancer if it's managed properly. So all the people I have known who have had thyroid cancers and have got the proper treatment, they have survived and are living normal lives.
Okay.
Because I always tell patients that if I had to choose one cancer to get in all the organs in my body, I would choose thyroid cancer. Because the ability to what we call cure or control thyroid cancer is maybe one of the most successful procedures or one of the most successful services you can provide to a patient with cancer. Because number one, it's relatively not easy, but it's possible to remove all of the abnormality, and then without too many complications, and then you're treated with something called radioactive iodine to sort of what you call mop up whatever little thyroid cells may be left.
Okay.
And you don't have to. It's not radiotherapy. It's the radioactive iodine is administered by getting a drip. So you go in and you get an injection and you put a little product in that, and the product circulates through your body and it mops up. So the cure rate, if you want to call it that, for managing thyroid cancers is pretty high. So that fear that people have about not coming because they worry whether it's a cancer, and they let that immobilize them from taking preventative action, well, I don't want to say it's not. It's a fear that is not rational, because if you come early and you get your thyroid cancer, you can basically live a normal life.
Right. So
that's pretty interesting, actually. Like you say, most people are just afraid to know. Some people are afraid to check. But
yeah, and I hope this.
But if they take the Nature Island approach, which is prevention is better than cure, they'll be. You see, they just become a little bit more nature island, prevention.
You said prevention, doctor. What for the listening public? What are some of the factors that make you more at risk for developing these enlargements?
Yeah.
Okay, that's interesting. But what I will do is first say that I'll deal with. That's very interesting, because I remember when I came back how many years ago, 30 or 40 something years ago, that the incidence, and by incidence, what I mean is that the number of people who were walking around with goiters, to me, was much less than the number of people I see now for goiters. So I would say that the incidence, the number of people who have goiters has increased over the last 30 years. And that's not restricted to Dominica. In fact, that's a global phenomenon. Now, the people who are most likely to have goiters, interestingly, are women. I remember when I was training, if there was a male with a goiter, it was considered to be cancerous until proven otherwise. That has changed. Right now, lots of men have goiters that are not cancerous. Whereas when I was training, 9 out of every 10 men who had goiters, we would think, even before we did surgery, that we would assume they would turn out to have had cancers of the thyroid gland, because it was so rare. Now, this change in what you call the demographic of everybody has goiter, it's honestly thought, well, goiters tend to occur more commonly in women. And that's because of the effect of the hormones. It's a hormonal thing. So because there's a fluctuation in hormonal, all the hormones every month because of menstrual cycles and all of that, that's one of the reasons why goiters. Now, hormones now are related to substances that can be mimicked by other substances we eat. So what is thought is that the change in our diet from a less natural diet to a more processed foods diet has been contributing to the increase in goiters in the society, because what it started, some of these processed foods, some of the chemicals in them mimic hormones. So when you should only have fluctuations in your hormones around your period, around your time of menstruation, you may be having that all month long because of the type of foods you're eating that may be mimicking some of the estrogens, some of the testosterone and other hormones in your body, and then forces the thyroid gland to adapt to these changes all month long, and then lead to the goiters or the dysfunction of the gland itself, where it produces less hormones than is necessary or more hormones than is necessary to cope. Because again, the thyroid gland produces hormones for the normal function of your body. So the hormones produced by the thyroid gland affect the production of all the other hormones produced by your body for your body to function normally.
Right.
So I mean, I don't have the evidence, but I would suggest, or I would put forward, that our diet, what we put in our mouth, again, prevention is also part of the key to reducing the risk of growth of your thyroid gland and having a goiter. A long time ago, it was thought to be the lack of iodine in our diets.
Right.
But that would just affect the hormonal. So if there was lack of iodine in your diet, you could end up being hyperthyroid or hypothyroid and not having nothing. So, but that isn't the case now, because we have iodine in all our foods, and we eat fish and iodized salt and all of these things. So it's thought that it's unlikely that iodine, although it's important to have iodine in your diet by the amount of fish you eat and not eating foods that reduce too much the iodine, which was thought to be the problem before, which may have been the issue before. Now it would definitely have to be one of the reasons would be processed foods or the diets that we have now that are maybe heavily meat-based, and these meats are now full of steroids and estrogens, etc., could very well be a factor in the increase in goiters and thyroid issues in our population. But in terms of thyroid cancer, some of the predisposing factors that is if you have a family member, a family history of thyroid conditions also is a predisposing factor. So that's why if you have a member of your family who has had a goiter, who has had thyroid issues, and you have a goiter, you should go and get it checked out. Prior, if you've had other cancers as well, you might be predisposed to getting thyroid cancers, because cancers can spread from other places to your thyroid gland. If you've had radiotherapy for cancers of your neck or your breast or your head and neck years ago, it potentially can predispose you to having cancers of your thyroid gland. But that's for cancer. That's a totally separate thing. As to why you get goiters and increase, that is not fully well known. but increasingly it is thought to be related to our transition from what I call health enhancing diet to diets that don't enhance our health, which means eating as much natural fruits and vegetables and non-processed foods as possible.
It would be interesting, I guess, to have the research done on that increased prevalence, doc, that you mentioned of goiters and
Yeah.
other lifestyle factors as well that have come about. So not just the change in diet. I would be interested to know about chemical usage, like the different exposures as well. Maybe what could be the link to those to the prevalence increase that we see in. Doc, we have I was about to say a patient, like we in the we in your office. We have a listener who has asked about the thyroid storm and asked if you could speak to that.
Okay, basically, what a thyroid storm is that your thyroid gland produces hormones for your body to function normally. So it's doing that on a daily basis. If for some reason or the other, your thyroid gland has a dysfunction, so instead of producing normal amounts of hormones, it produces too much hormones. So when it produces too much hormones, as Doc said last week, that's called your hyperthyroid. And hyperthyroid means you have too much hormones, so you tend to be a little bit, you get restless all the time, you're sweating, you're nervous, your heart is beating fast. All of these things are when you have overactive thyroid gland or your hyperthyroid. Now, this can now be controlled. You have to take the medication for up to 2 years to control the problem. Now, if during that period, for whatever reason, you have a surge in the amount of excess hormones you are producing, then you get something called a thyroid storm. That means your body is now overwhelmed by too much hormones. Interestingly, that can occur during surgery for an overactive thyroid gland, which is unusual. So during surgery for an overactive thyroid gland that hasn't been well controlled by medication, you can get a surge in the amount of hormones coming from the thyroid that gets into your blood system and then gives you what we call a thyroid storm, which is just an excessive amounts of thyroid, a high level of thyroid hormones in your system that now makes you twice the symptoms you normally have are double. So if your heart rate used to be at 100, it might be beating at 200.
Wow.
If you were sweating, you're just sweating and you can even collapse with it. So it's a pretty dangerous and urgent complication of having an overactive thyroid gland.
Is there mortality associated with having a thyroid storm? Can the person
Yes,
die?
If it's not treated, if it's not recognized and treated immediately, yes, there's a high mortality related to it.
Okay.
But thank God, when it has happened, it usually happens during surgery. It may happen at any other time, but it usually happens during surgery or when you have an overactive thyroid gland that is untreated.
Okay.
So then you have an overactive thyroid gland, you're not taking your medication, you're not treated, you get something like the flu or something like that or some other condition, then you can get a burst of thyroid hormones being produced and you get a thyroid storm. Now that's a medical emergency that you have to get treated for almost immediately. Otherwise, the mortality is then very high.
Okay.
At least now we know what to expect for those of us who already have, hyperthyroidism or we having all of these. Doctor just pretty much outlined the kind of things that you might see if you're in crisis please, I know a lot of us like to work and say we just under a little stress and we push through it. If you experience these things, get yourself to the accident and emergency department so that you can get treated.
Mm-hmm. Doc, we are, already at the end of the time of the program, and it was short but very very informative. I must say, I think we got a lot out of the short time that we had with you, Dr. Pascal. But I did want to wrap up with you telling us specifically when should someone see their ENT, as it relates to what we were speaking of, goiter or swelling in the neck. When do you come in? I want that, and of course, as usual, I want you to tell our listeners how do they reach you if they need to. I always like to end with that. So, Doc, over to you. When should someone come in to see Dr. Pascal for thyroid related issue?
Okay, usually, I mean, in medical practice, usually get referred to the ENT surgeon or the surgeon by another physician for a goiter. Usually, I mean,
So normally by referral.
Yes, you don't have to. I mean, there's a luxury in Dominica that you can find me. I'm not that inaccessible. But I mean, what I would say more importantly is that if you notice any lump in your neck, any swelling in your neck that hasn't been there, at a minimum, you should go to your physician, because most times it doesn't really require surgical intervention. It's very rare that at the beginning you come to me for me to do surgery usually. Okay, so it's usually at the stage where surgery is in, that I would say, but the patient may not be in a position to decide that. So if you want to take a prevention is better than cure approach, I would say, as long as you're concerned about the lump, you go see your ENT lump in your neck, you go see your ENT surgeon or your practitioner or the endocrinologist. Okay.
Okay.
So
Okay.
I because people sometimes like now I'm in debauch there with this thing, and people are saying, well, they can't see me, and then it gets a little bit tricky for me. So I wouldn't want to say that you have to come and see me and then I'm not available. So I think my advice would be, if you have a lump in your neck, you're concerned about it, you think it may be a goiter, go see a health practitioner or come see me. Or if that health practitioner should then can assess you and say, well, I think you need to go to see the ENT surgeon right away, because sometimes it may not necessarily mean ENT intervention. It may just need medication to control the swelling. Okay, that's it. What's the other thing you said?
How do they
How
reach
do we
you?
get to you? Where are you?
Oh, my office I think is available. My office number is 275-3551. I'm located in Goodwill, and I'm easily accessible. At this point in time, I want to reinforce that it might be a little difficulty because I am more occupied with what I'm trying to prevent happening at debauch. I'm into my prevention mode again.
Okay.
And get some patience with me. Okay.
Or they might have to catch you in debauch, Doc.
Yeah, they might have to come to debauch and stand with me.
Right.
Get treated one time.
Dr. Pascal, thank you so much. I know, we had a bit of a challenge hooking up, but we came through. You came through. And I am so happy you were able to join us this morning on Health Vibes. Thank you so much.
Everything blessed. Thanks.
All right.
Yes,
Thank you.
Take care, doctor.
So that was Dr. Irvin Pascal, IP. Of course, we were discussing the aspect of the surgical interventions may be required for thyroid disease, like goiters. And I think quite a bit of information was shared. I know our callers maybe wanted to get to interact with the doctor, but we did have him via telephone. So it was a bit difficult for us this morning to sort of engage. But I know we will have the doctor again. He's a regular here on Health Vibes, so you can interact at that time. I see some of our viewers on the social media platforms ask some questions, which we tried to get to. And also, there was a suggestion a bit earlier from a listener as it relates to a men's health topic, which we actually did about 2 weeks ago. So I just encourage all our listeners to always tune in to the program, because a lot of the things you want to hear, we're going to bring it to you. So if you're always on Health Vibes, you're going to get some of those topics that you want. But Leona, end of our time already. But we did mention a bit earlier, it's World Cancer Day. And so February 4th, observed as World Cancer Day, to raise awareness of cancer and encourage prevention, detection, and treatment, of course, to the cancer survivors. This is a day, of course, to acknowledge your survival and perseverance through the disease. We have so many forms of cancer affecting our population, and the treatment and the course of proceeding through the disease is often very expensive.
Indeed.
Yes, takes a toll on people's mental health as well. So to those who are survivors, cancer survivors, I just want to use today's episode to reach out to you and wish you continued strength on that journey. Leona?
Yes. And I think too, the theme for this year is united by uniqueness, or
United by
united by unique. Yes, united by unique. And so that basically just says every person's journey is different. Every person's encounter with cancer is also different, whether or not you share the same types of cancer. And so we need to remember the person. We need to remember the people that are suffering from this, and not just the disease. We also need to take account of where they are, the support they might need, listen to them, and understand, of course, their situation.
So as we wrap up today, we want to encourage you. I know we had some other things to discuss that were going on at Jolly's. I'll just mention one because we're already out of time. I don't want us to be thrown out. I don't want us to be thrown out of Q95. I know Leona did give some of the happenings. There's a Halle Barrage spin and win promotion going on at Jolly's. So if you are at JP Mega today in Fokole, you can spin a wheel if you buy 3 sachets of Halle Barrage multivitamin. You can spin a wheel and win event tickets, gift vouchers, and other prizes. Great George Street, your day is the 6th. And King George V Street, your date is the 7th. So you can look out for that at the various branches. The Portsmouth branch, your day was yesterday. So you all got that opportunity to spin and win. And I know people like to spin that wheel and win something.
Indeed. And these immunity sachets, they really do come in handy for the season, to get your pockets to go on the road, or just get your pockets in general, because even if you're not on the road, the flu season is soon to follow.
I know. I know. There's so many people with the flu right now. Like, I'm just seeing people walking around. And the people are, however, I am seeing people using their masks though, which I must applaud them for.
It's become a norm.
Yes, people are using masks as we have advised in the past. If you have the cold or the flu, to prevent other people from catching your virus, wearing the mask is really recommended. So I have seen people wearing it. I want to applaud them for that. There is something else coming up tomorrow, Thursday. Once again, it's carnival season. You want to get into the mode of exercising. There is Fit District where you can get hyped for the road. And that is tomorrow. We're going to have this fitness session there that you can join. And the location of the fitness session in the park, I'm trying to see the location on the flyer, but a fitness session on Thursday, 5:30, and there is music and a trainer available. I
look out for the Facebook page.
Yes, I need to get that location right to get hyped for the road.
Definitely in the park, and that's the CG United and zest,
Right.
wellness.
So, Leona, let's sign out. This has been Health Vibes for today, Wednesday. If you are able, catch us again next week. We actually have a very, very interesting topic for you next week. We have somebody who will be joining us in studio, and next week is going to focus on alcohol abuse. So, next week, please join us. Tune into Health Vibes, and until then, we will be wishing that you have a very healthy week. Always healthy week. Great week. See you all next week.
care.
Take care. Bye bye.
Health Vibes, each and every Wednesday from 10 to 11:30 a.m. with your hosts Trudy Kristen and co-hosts pharmacists Jacinta Fagan and Leona Jeremiah. Education, information, and a bit of humor, and not forgetting lots of vibes. Jolly's Pharmacy is bringing health and vibes together with Health Vibes. So be sure to tune in each and every Wednesday on Q95 from 10 to 11:30 a.m. Jolly's Pharmacy, leading the way in healthcare.
Easy Rock 95.1. More rock, less talk.